Well, hello everybody. Thank you for joining us. My name is Jillian McMullen and I'm the Bariatric Education Specialist. And with me today is Dr. Stephen Hodgett and Dr. Craig Morgenthau. And they're going to be answering some of your questions and also just going over the basics of weight loss surgery and who's eligible and all of that kind of stuff in between. So just to get us started, Dr. Hodgett,
Sure.
Can you give us just kind of a basic overview of what exactly is bariatric surgery?
Sure. So bariatric is the medical term that we use for the treatment of obesity. Bariatric surgery are the operations that we do to help promote weight loss. We've been doing for about 50 or 60 years in one way, shape, or form. Some have worked better than the others, but what we're doing now these days have been around for at least a decade and have had really great results.
Okay, thank you. Dr. Morgenthau, this question's for you. Who is eligible for bariatric surgery if they wanted to come and talk to you about it?
So usually patients that are morbidly obese, about 100 pounds overweight on average. So we tend to use BMI, body mass index, which you could look up your BMI at baptistbariatrics.com. There's a BMI calculator. So if your BMI is over 40, or if your BMI is over 35 with a comorbidity, such as type 2 diabetes, hypertension, obstructive sleep apnea, you qualify for bariatric surgery. One point to make is Medicare does require to have a comorbidity if your BMI is over 40 as well.
Okay. And any of you guys that are tuning in at this point, if you have any questions, please feel free to give us a message, a private message, or you can just comment right below on this video. All right, but we'll go ahead and just continue on with Dr. Hodgett. Can you tell us what types of bariatric surgery are offered at Baptist?
Sure. So we offer basically 3 different types with some caveats. The standard operations we offer are laparoscopic adjustable gastric band. Now, laparoscopy or small incision surgery, if you know anybody's had their gallbladder taken out, or maybe a hernia done laparoscopically, it's through small incisions. It allows faster recovery. It's actually safer to do that way. Laparoscopic adjustable gastric band, which most people have heard of, or the lap band you've heard of, and then a laparoscopic Roux-en-Y gastric bypass, and laparoscopic sleeve gastrectomy. Now, full disclosure, we've really sort of gotten away from a laparoscopic adjustable gastric band from a lot of different reasons. The biggest is a lot of them have to come out. So in the United States, a little over 70% of them seem like they have to come out in about 10 years. But the sleeve and bypass we've done really, really great with. And we're also starting to use in investigational situations what's called a biliary-pancreatic diversion and duodenal switch. Now, they're very complicated. This isn't long enough to describe each one, but if you come to our seminar, or you'll learn a little bit about each one.
Okay. Well, Dr. Morgenthau, can you, with all of those options, can you tell us how would somebody know which one is right for them?
Yeah, that's a great question because it gets confusing when you have options. It's good to have options, but how do you pick the one for you? I guess since about 2013, the sleeve gastrectomy has been the most commonly performed procedure in the United States. The reason is that the weight loss is excellent and there's less potential complications than a gastric bypass. A gastric bypass was the gold standard, and we still offer that for some patients if they want to have that, or if they have a history of severe gastroesophageal reflux disease. Sometimes if patients are on anti-reflux medications and they still have severe breakthrough reflux symptoms, we would offer them a gastric bypass. Or if somebody is diabetic and they want a little bit better improvement in their diabetes or a little bit higher chance of remission, then we'd recommend the gastric bypass. It's about 85% improvement or remission with the gastric bypass, about 70% improvement or remission with a sleeve gastrectomy. A biliary pancreatic diversion with duodenal switch has the highest comorbidity improvement or remission rates, but it also has the most potential complications, so that's why it's less than 1% of operations in the United States today. The number 1 procedure is a sleeve. If people have severe reflux or diabetes, then maybe we start looking at the bypass.
Okay. Dr. Hodgett, can you elaborate a little bit on the potential risk, but also the benefits?
Sure. So any operation carries risk, but they have gotten really low. I think one of the most, the fantastic things in the evolution of bariatric surgery is really the improvement in the technology that we use to do these operations. But there's risk to any surgical procedure, like blood clots. Blood clots go to your lungs, probably your heart, kidneys, stroke, pneumonia, for example, but they're, again, very, very low. These operations, the fact that we can do them through the small incisions and we can do them faster, make those really low. But most importantly, the benefits. Now, when you talk to patients, the number one they think about is weight loss and looking better, and that's clearly a great option, and the number one reason I think most patients look into this. But from a medical perspective, what these operations help you do are incredible. They can give type 2 diabetes, they can get it under dramatic control or even reverse it completely so you're off your diabetes medications. High blood pressure medication can go away, which is great, so you're taking less pills every day. Sleep apnea, patients that have sleep apnea and on the CPAP machines blowing things up their nose all night, trying to keep their airway open, the weight loss dramatically improves that, so we'll hopefully get those people off those as well. So those just some really important things.
And I know we all, just working with bariatric patients, we all have some really good stories about things people are doing now, and you know, some of the milestones that they hit as they lose weight.
Some of my favorite stories, you know, I always tell this at seminars, but one of my first patients, you know, he told me he walked on the beach with his wife for the first time in 25 years, and that kind of thing, and play with your grandchildren and just be able to bend over and do things that you haven't been able to do because of your weight or just mobility limitations as you start shredding that weight off, the energy, it's just really, really cool for our people.
Yeah. Do you have a favorite story?
Well, I just, I just want to add on to what Dr. Hodges said. I mean, these operations are about wellness, and all the medical problems that can happen, they add up, and there's an average of about 10 years less life expectancy. There's a lot of studies that show that survival of patients that have bariatric surgery is much higher than patients that don't. So that's the bottom line, is this is to improve your health, wellness, your lifespan, and you get to do the quality of life things that you couldn't do before, work-related activities that maybe you couldn't do. But the world can open up to you. You just have to work hard to get success with the operation. So,
Dr. Morgenthau, can you tell us, does insurance typically cover a procedure like this?
So most employers that are large companies, if they have maybe over 500 employees, they typically, about 75% of them will cover bariatric surgery. Less than 500, it might be maybe 25%. So what we do, we check every patient's insurance to see if they have coverage, and every different insurance company will cover it. It depends on what your employer and your human resources department chooses to cover. So we will check your policy, and if you don't have coverage, then we have different options for low interest financing and things like that to help patients to get access to have surgery.
So we have a question that just came in about, do you have to diet or watch what you eat after you have the surgery?
You want me to take it? Sure. So that often depends on your insurance company. First off, around the time of operation, our patients are on a 1 week or 2 week specific medical diet to help promote liver shrinkage. So the liver sits where we do the operation. So we put people on a fairly strict diet for either 1 or 2 weeks prior to surgery based on what's called their body mass index or BMI. That's the formula Dr. Morgenthau spoke about earlier about. And on our website again, you can go in and check that to calculate your own BMI. But so for your 2 weeks, you're basically on a shake type diet for the breakfast and lunch to help shrink your liver. Prior to surgery, we want you to try to lose weight. And more importantly though, some of your insurance companies will require either a 3 or 6 month medically supervised weight loss program where you'll be working with either a nutritionist or your primary care doctor. So that gets really complicated as far as which each individual patient needs to do, but that's why we're here, and we have a dedicated staff to help work through some of those hurdles prior to surgery for you.
Just as far as long term, I think that's important because whichever bariatric operation you have, you do have to change how you eat. You have to have small bites. You have to chew thoroughly, eat slowly, and we recommend a high protein, low carb, low fat diet. You could still have tasty food. You just have to have smaller quantities and healthy choices. We say high protein, baked chicken, lean ground beef, fish. Low carb, just a little bit of whole grains. Don't want to do a lot of breads, pastas, potatoes. healthy fats, no fried greasy, no junk food. I think one thing that's very important, you can't drink while you eat. That's something that's a little bit of an adjustment. You wait 30 to 60 minutes and then you have 0-calorie liquids only, water, unsweet tea, water with lemon. That's the diet. That's a long-term, it's not a diet, it's just, this is now how you eat.
Yeah, that's for your life.
And you have this tool from bariatric surgery to reinforce the right behaviors.
And understand, it's not that you have to eat these, but if you really want to promote success, these are the important things to do. Because it's not just a 3 or 6 months for the first 3 to 6 months, weight loss is easy. But what we're really trying to do is change it for life, and so to keep these things on and keep these new habits moving forward for decades, because that will help keep the weight off.
All right, so what you guys are saying is basically this is a lifelong commitment.
Absolutely. This is not, this is a tool for success. We always say that, and there's truer words have never been spoken. This is not a cure. Your buy-in is really important to help this, not just again for your early recovery, but long-term success.
As far as long-term success, when we talk about diets don't work because in general your hunger hormones stay elevated to before where you started a diet, and your body gets more efficient or you lose less weight the longer you diet. So in the long term, less than 5% of people are successful. Here we're giving a tool, but they have to use it right, and it's never going to be easy with bariatric surgery, but this is the highest chance and the most successful, and there's so much data and research. This is it's a major step forward when patients they have bariatric surgery. It's the key tool that they need to be successful, but the behavior change is just as important.
So we just got another question. How long after surgery can I get up and move around?
Immediately, actually, we have a dedicated bariatric floor as part of our accreditation as Center of Excellence, but you will find the nurses near militant about moving you around. So we actually walk you from your gurney on the floor to your hospital bed, and we want you walking up 2 or 3 times that night. You'll also be on clear liquids the first night of surgery. After that, again, ambulation is the most important thing to prevent any postoperative problems with your lungs or blood clots, so we want you walking all the time. As far as post-op recovery, what I tell my patients is no heavy lifting, pushing or pulling more than 10 pounds for 2 weeks. No submersion water for 2 weeks, but you can shower the day after surgery. But we hope you go outside, see sunshine every day. That's going to help you feel better quicker.
I'm trying to get the hospital to install facial recognition technology to monitor the patients, and hopefully we can see how much they're walking after surgery. Very important to be up and out after surgery. That was a joke, but we want you up and out.
Yeah, and a lot of people want to know how many nights will they be in the hospital?
90%, maybe 95% of our patients after sleep go home the next day, about 75-80% after gastric bypass.
Okay.
So, and if there's any issues, then we adjust. We take each patient as individuals, but that's in general. And we want people up and out right after surgery and never looking back, and just do more and more activity every day, and that's basically it. As far as going to work, I think Dr. Hodgin mentioned, usually you might need a week off work, maybe a week of light duty, no heavy lifting for a month or so.
Yeah, the funniest thing's ever happened is since we lost sick days and went to pay time off, we used to have to try to get people back to work. Now everybody wants to go to work as soon as they possible because they'd rather be on a beach someplace using that PTO than sitting at home recovering from this. So most of our patients, especially, we do a lot of nurses in our hospital, and they seem to be back within about a week or so.
Dr. Morgenthau, anything else that someone could expect before or after surgery that you can think of?
Let's see. I think that we want patients to take advantage of our program. Dr. Hodgin mentioned that we're an accredited center. The term Center of Excellence, that's what we are. We use the term accredited center. And we just want our patients to take full advantage of everything that we have to offer. We're always trying to get better and better to support our patients in success for the long term. We have an online Facebook community page, so we have a whole community of people across the spectrum of life that participate in that, but that's not the same as coming in person to support groups. We want our patients to come at least every other month the first year, and then every 3 or 4 months after that. This is a long-term commitment. Our patients see us at 2 weeks after surgery, at 3 months, 6 months, and then every 6 or 12 months after that. So we want patients to make good choices every day, stay focused long-term by participating in our program. I can't emphasize that enough.
Okay.
So we got a question about, is there any type of workshop or seminar that I can attend to learn more about this?
Oh, sure, absolutely. That's actually what's called, to get become candidate for bariatric surgery, it's part of a 3-step process at Baptist Center for Bariatrics. The first step is a seminar or a webinar. So our seminars are available online. You can dial 202-SLIM, that's 202-SLIM, or go for BaptistCenterForBariatrics.com to see a list of our available seminars. And if you have difficulty getting to those, there's a webinar. It's about 23 minutes long also. Again, on BaptistBariatrics.com. It's the Baptist Center for Bariatrics. I'm sorry, it's BaptistBariatrics.com to watch our free webinar. That will also qualify you for our Step 1 visit. So you can learn about those things if you're just a little interested, maybe don't want to drive to see something. You can watch that first and come to a seminar, answer questions. You know, we do them at least every 2 weeks, either at our main campus at Baptist Downtown or at Baptist South.
Just to add on to Dr. Hodges mentioned Step 1. So Step 1 is kind of your initial education, whether through the webinar or seminar. Step 2 is coming to see us in the office, where Dr. Hodges and we will look at your medical and surgical history, medications you're on, and everything like that, and come up with a plan of care, which operation you choose to do, and to order any tests that you need to have. And then Step 3 is after those tests are done, you come back and we talk more about surgery and we get you scheduled, and so it's a 3-step process is what we use. So.
Okay, one more question. How much weight can I expect to lose?
So for the sleeve, we say about 60% or so of your excess weight. So if somebody's 100 pounds overweight, it would be about 60-pound weight loss. If you're about 200 pounds over your ideal body weight, whatever that would be, so you'd expect to lose about 120 pounds. And that's average. Some patients lose less and some lose more. With the bypass, it's about 60 to 70% excess weight loss. And of course, there's patients that have a sleeve that lose more than those that have a bypass, and vice versa. I mean, they're all good tools, the bypass and the sleeve. It just depends, and that's why we emphasize the right behavior after surgery and doing all those things that make you successful. So they're both good tools, but average weight loss, about 60 to 70% of your excess weight, probably about 100 pounds on average, depending on how much overweight you are to begin with, or over your ideal body weight, I should say.
Yeah, I think the spectrum there is the most important thing that he discusses. We do have patients that really based on their buy-in of success and really life-changing, they can get down to normal weight as well. But in bariatric terms, we look at sort of large quantities of patients to determine those expectations. But I have patients that have done exceptionally well down to normal weight.
Dr. Hodges mentioned the majority of the weight loss is probably in the first 3 to 6 months, but you're still losing weight out to a year. A lot of patients. I've had patients lose weight out to 2.5 years, and it really is a reflection of how well and healthy you're eating and exercising. And where we have patients start, a lot of patients have made positive changes in their life as far as eating healthy and exercising. And then when they come to see us, they make even more positive changes. And as they get better and better, they have more weight loss. So it's very exciting to watch the transformation that people have. So
it's really about breaking what we call the vicious cycle of obesity, where you continue to gain weight and you become more sedentary because it's harder to move around. I always tell patients, when you're 115 pounds overweight, it's like carrying 10, 15-pound bowling balls up your body every day to work, every time you get out of bed or climb up a flight of stairs. So as you start shedding those bowling balls, the energy comes off. And I think that becomes magnetic as they break that vicious cycle of obesity and get more energy and more energy. And I think that can become addictive for patients too, in a healthy way.
That's a good way to look at it. I never thought about the bowling balls, but that makes a lot of sense.
All right, well, thank you so much for tuning in. If you didn't catch us live and you're going to watch the replay, remember that you can always send us a private message, or you can email us at bariatrics@bmcjax.com. You can also call us at 904-202-SLIM. And thank you for joining us.
Thank you.
Bye.